We're here in the Skin Clinic in Drogheda, County Louth in Ireland, and we're going to talk today about some of the treatments that we use for acne. I see a lot of patients with acne, and I've been treating them for 30 years now, and when they arrive they're always a little bit apprehensive, particularly about side effects of medication, and in particular they're very apprehensive about isotretinoin, also known as roaccutane, and what's the potential side effects. Well, their main concern is mental health side effects. However, over the past 30 years that I've been treating people with isotretinoin, the mental health side effects have been very minimal. The main reason for this is that if you use it at an appropriate dose and you tailor it to the needs of the patient, then the side effects can be minimized. So people worry about the mental health side effects in particular, but they're very rarely encountered. I think it's very important to tailor the dose to the patient. You have to review the patient every month and monitor them very carefully and ask them about any symptoms that they might have. But if you tailor it appropriately and start low and increase gradually, you get very little mental health side effects. It's something that we really don't encounter at all. In fact, I would say that the person's mood is generally better because they can see their acne improving. So I wouldn't let this potential side effect, or something that's talked about a lot more it's not something that would preclude the use of isotretinoin. The second potential side effect is teratogenicity. So that applies to female patients. So we know that female patients cannot get pregnant on isotretinoin. That would be very damaging to the fetus, and we just can't let that happen. So we warn the patients and advise them very clearly that they cannot get pregnant, that they have to take contraception, particularly if they're sexually active, and we monitor them very, very carefully. We do a pregnancy test every month. In fact, I say to my patients, the sexually active patients who are on isotretinoin, to do the pregnancy test at home as well, to do it every 2 weeks, because that's the major thing that I worry about. We don't worry about mental health side effects in general. It's not an issue, and I wouldn't let that put people off, but we do have to be really, really careful not to get pregnant. Other side effects then are dry lips. People do get dry lips, and most people on roaccutane, but we can deal with that. We have ways of dealing with that. I wouldn't let that put people off either. They talk about liver risks, but in fact it's something that's very rarely seen. And when you look at the figures on liver injury from medications, it's actually antibiotics that cause most of the liver injury, not isotretinoin. Other side effects then, potentially, if a person is prone to nosebleeds, they can get a worsening of nosebleeds, but we can deal with that. That's not going to be an issue. We also want people to be very careful in the sun, because we know that they'll burn very easily if they're out in the sun on isotretinoin. So they do have to wear factor 50 and seek the shade, try to stay in the shade, because that's something that can happen. I've seen that happen before, so that's an important one. Other side effects then, we have to think about, like, not to overdo it in the gym. You got to be careful not to go to put the muscle under too much pressure, because there have been rare cases of muscle injury. So don't overdo it in the gym while you're on, or overdo it with sports while you're on isotretinoin. So they're the main things that we come across, and in fact most of the patients sail through the course of isotretinoin without difficulty. And sometimes I feel it's sad that people have put it off, or maybe the parents have put it off, because they feel that there's going to be major side effects with isotretinoin. But in reality, when you use it appropriately and you check the patient every month and increase accordingly, you don't encounter those side effects that people are so fearful of. And it's a fantastic treatment, and probably for severe acne, it is definitely the best treatment. Thanks.